Hi everyone, I'm Dr. Sue Cancer Vet. For my next vlog, I'm super excited because I'm back in the clinic. So let's see how my patients are doing, including Pokey, who's out over 2 years for her lymphoma. She's off chemotherapy, and I'm going to answer a question that I commonly get. Can we cure lymphoma in dogs? Hey everybody, welcome to the vlog. It has definitely been a while since I've done a vlog like this. So I thought it would be fun to get back in the clinic and show you guys my new place. Some people have asked, what's going on at your new job? So I've been here for a couple of months. I love it. Great team. Super excited to introduce you to Joe and Katie. All right, everybody, I want to introduce you to the amazing Katie. Woo-hoo. So Katie's my assistant. You've been working for me for about
2 months.
2 months. So I've been here for 3 months. So what do you think?
Love every minute.
And she's awesome.
Learning so much.
So Katie is a dedicated assistant to our team, and she's just been awesome. You've been with the hospital for a little bit longer, right?
Yeah. We did surgery.
All right, so I'm gonna put you on the spot. What has surprised you most about the oncology service?
I think how much people are willing to do for their pets, honestly.
Yeah?
Especially in their older age, because I didn't know people were willing to take that good of care of pets when they're 14, 15, 16.
We repeated her blood work because of the high cholesterol and triglycerides on the fasted sample. We got the urine and culture, and then I'm either gonna see you back in 2 to 4 weeks, but we're gonna wait for everything to come back before I can book your appointment. And her lymph nodes feel great, so her lymphoma is still in remission. 2 years, 4 months later, baby girl.
Yeah.
And that's my sweetie.
Yeah.
So, you know, for the last couple of months I've been at a new place, and it's a great place. I'm only there 2 days a week, but a lot of my patients are still with me, which is super fantastic. So this video, the first patient that we're gonna see is Pokey. The question that you guys are all thinking when you're watching this video is, can we cure lymphoma in dogs? And again, this will be, you know, can we cure other cancers as well? But I'm going to focus on lymphoma in dogs, and let's talk about Pokey because she's a great example. So Pokey was diagnosed in 2 years and 4 months ago. So in February of 2017 with multicentric B-cell lymphoma, so the most common type of lymphoma that we see. Dad elected to put her on CHOP multi-agent chemotherapy. So that is considered to be the standard of care and the best chemotherapy protocol that we have. She went into remission. She finished her protocol 5 months later, like most dogs do. We also did, at the time, we put her on a monoclonal antibody that was available on the market at the time that is no longer on the market now because it was not shown to be effective for the majority of dogs, but she tolerated it very well. She relapsed 4 months after finishing chemotherapy, which is average. So it's what we expect for the majority of dogs going through chemotherapy. And I was really disappointed because I expected with a combination of the monoclonal antibody, this immunotherapy, which would help boost her immune system to attack the cancer cells, and the chemotherapy would be killing her cancer cells, that she would do better. And typically, when they relapse, and again, I have other videos that will link up about when dogs relapse, I tell the owners that the second remission will be about half the length of the first. And this is a really good example. Pokey's a really good example of why statistics don't always predict the individual. So her first remission was average to a little bit short. So it was only about 9 months, including her chemotherapy. So 5 months of chemo, about 4 months after that, that's when she relapsed. So how long should her second have remission been? About 4.5 months, right? So we went back on the CHOP multi-agent chemotherapy protocol. And often when they're done with chemo, they'll graduate and they'll go off chemo again. But I had a discussion with Dad about maybe keeping her on maintenance chemotherapy. And this is not standard for every dog, and this is where it's great to have an oncologist, a cancer specialist, and have that discussion. But we decided to keep her on maintenance chemotherapy, and we did that for a full year. She was also on lots of supplements. So, you know, not for a spoiler alert, but Ms. Pokey is still in remission, and we are 2 years and 4 months out. So, you know, her second remission has been longer than her first. So a really good example that statistics will not predict the individual, which makes me super excited and super happy. So let's go back to the question. Can we cure lymphoma? When do I call sweet Pokey a cure? I don't know that we know that answer. You know, to go back to the overview, if you're watching this because your dog was diagnosed with lymphoma, in general, we don't cure lymphoma in most dogs. Usually when they're in remission, and I put that in air quotes because that will be something that your cancer specialist or your veterinarian will say, there's usually some degree of microscopic cells still present. And at some point those cells divide and start to repopulate their lymph nodes. So at some point her lymphoma will probably relapse, and that's probably what she'll succumb to, which is hard because I love this dog like she's my own, and her dad has become a dear friend of mine. While the chemo was getting made, she just sat on the little mat and just sat there waiting. She was like, I know the routine. She's just perfect. All right, guys, our next patient is Lucy. I love Lucy. Anyway, Lucy is a 5-year-old female spayed Great Dane. She is just fabulous. I know 5 just seems, you know, kind of young when it comes to cancer, but unfortunately, large and giant breed dogs, they age more quickly. And she was diagnosed with osteosarcoma in the distal radius, so right above the wrist. And that is one of the most common locations for osteosarcoma. I actually, guys, just did a bunch of videos on bone cancer, so we'll put a link below. So if you want more information on bone cancer, I have 3 new videos all about bone cancer in dogs. So this is a pretty classic age, so 5 to 7 years. Classic breed, Great Dane, large and giant breed dogs, classic location. So Miss Lucy is coming in today for her 3rd of 6 carboplatin treatments. She's doing pretty well, and we're gonna run some blood work, give her chemo. Great blood work on Lucy. Everything is normal. And if we're lucky, maybe we'll get to meet Dad because he's super fantastic. I think he has a couple of Great Danes. Say bye, Lucy! Get ready to go. Good girl! All right, see you in 3 weeks?
Yes.
You're so handsome. So Yam is a kitty, this orange boy. I love orange boys. He was just diagnosed last week by our internist, Dr. Whitney, with large cell gastrointestinal lymphoma of the small intestines. Yam's symptoms were weight loss and diarrhea, and he actually had really stinky diarrhea 2 times during the exam room. Other common symptoms of gastrointestinal lymphoma in kitties can also be poor appetite to anorexia and vomiting. And sometimes they'll have all of those, and sometimes they'll just have 1 or 2 of those. And they could just have 1, it could just be weight loss, which can be confusing. Anyway, their other kitty, which I didn't get his name. Oh, yes, I did. Mickey was just diagnosed with small cell lymphoma. And the big difference with small cell or low-grade lymphoma is that's treated with steroids and oral chemotherapy called Leukeran or chlorambucil. And he's doing really well, and he's gaining weight, and his symptoms have resolved, and they really were hoping and excited that Yam could be treated that way. Unfortunately, he can't. And the best treatment for high-grade or large cell lymphoma is injectable chemotherapy. So that's what we started this week with Yam. If you're looking for more information on lymphoma, again, we have lots of videos, so you're going to want to check out the lymphoma playlist. I think I also have one of my lectures from Norway from a couple of months ago is all about kitty gastrointestinal lymphoma, and I talk about both low-grade and high-grade. I have a Q&A that we just did a couple of months ago, so lots of information, lots of resources. So he's getting his first chemo. We're starting with Elspar. He'll come back next week for vincristine. Hopefully we'll get that diarrhea under control. In addition to his steroids, I'm adding a probiotic and diarrhea medication, metronidazole, and also going to be testing him for something called a maldigestion profile, see if he needs some B12 supplementation, because that will often be abnormal in kitties with either high-grade or low-grade lymphoma, and supplementation can be really helpful. CBC looks good on Yam. Actually looks great. Look at that, like no error messages. Perfect. Ooh, boring blood work. I like it. All right, I'm gonna go write our chemo orders You want a pre-med with 8 milligrams of Benadryl?
Yep.
My day is officially complete. I can get out of my work clothes into my comfy clothes. I hope you enjoy the vlog. It's fun to be back in the clinic, or at least share what's going on in my world with you. If you enjoy this, please comment, share, let me know. Thanks for watching so much. It's always a pleasure to help you through the horrible journey of cancer, and I appreciate you being here.